Today's core workout is designed for your third trimester of pregnancy to help keep your pelvic floor muscles and your transverse abdominis strong. This will help relieve any lower back pain, as well as help with the delivery and the recovery postpartum. All you need is a chair and some space on the floor. If you're new to my channel, hey, my name's Meg, I'm a physiotherapist. Remember to always make sure you have medical clearance before commencing an exercise program. These exercises are safe, but remember, if you feel any shortness of breath, dizziness, pain or pressure, make sure you stop the exercises and book in with your medical professional. Starting today in sitting on the chair, we'll sit right on the edge and just check in with your posture. If you have good posture to start with, it's easier for your pelvic floor muscles and your transverse abdominis to come on and protect your spine. So starting out with your feet wider than your hips as the belly has started to grow now, and you just need a little bit more space through that pelvis. Sitting right on top of the sit bones, ribs stacked above hips and nice and tall through the crown of the head. So just starting off with 360-degree breathing into the back, sides and fronts of the lungs. So we take that breath in through the nose, and then just breathing out through the pelvic bowl. Take a nice big breath in, and then breathing out. So now let's check in with the pelvic floor. Big breath in and you feel the sit bones widen. Pelvic floor relaxes, and then as you exhale, you feel that gentle squeeze and lift through the pelvic bowl. So take that nice big breath in, you'll feel your sit bones widen and the pelvic floor relax onto the chair. And then as you exhale, imagine you're sucking that blueberry up a straw into the vagina, contracting the pelvic floor, and then inhale, let it melt back down onto the chair again. So breath in again, and then exhale, just connecting, lifting up and in through the pelvic floor as we gently hug baby towards the spine. Now getting some activation through that transverse abdominis. So keep breathing in, and then exhale, pelvic floor, hug baby towards the spine, and then inhale, release. 2 more breaths here. Always making sure you stay tall through the crown of the head. Last breath here. And now just adding some breath to movement. So as we inhale, we'll roll forward on the sit bones. And then exhale, we're gently rolling backwards, hugging baby towards the spine. And then inhale, lengthening back out. Exhale, zipper. Inhale, lengthen. So it's a nice position to do a reverse curl. You can always check in with the abdominals to make sure that there's no pressure or doming through that abdominal wall. Just work within a range that feels comfortable. Inhale, lengthen. Exhale, squeeze and lift through the pelvic floor. Hug baby towards the spine. And then inhale, release. We'll do 2 more. Inhale. And then exhale. Inhale back to center. We're going to raise the arms up in front. Same movement, except we'll add a gentle rotation. So as we exhale, rolling back off those sit bones, we're going to open up through the right side body, and then inhale back to center. Nice and tall. Exhale, rolling back. So you are in a gentle C curve. And then inhale back to center. Really focus as you open that it's the ribs opening and drawing you back rather than just the hands doing the motion. Exhale, open. Use that breath as you exert yourself. Inhale. Exhale, open. Inhale. We've got 2 more to either side. Last one. Coming back to center. So now just making your way into a plank position. I'll move the chair so you can see me. We're going to come down onto your elbows and we're going to find that plank position. So gently bring the hips forward so you're in a nice neutral spine. Press that chair away so you're active through the shoulders, long through the crown of the head, and you're just going to focus breathing. So breathing into the back, sides, and the front of the lungs, making sure that we don't let those hips fall forward and arch into the lower back, but as well as we don't sit the hips back and miss out on that core engagement. So again, bring those hips forward, focus on the breath. A nice way to do a modified plank in that final stage of pregnancy. 3 more breaths here. Last breath here. And we'll just add some leg movement. So I want you to take a breath in as you prepare, and then as you exhale, I want you to find length through that right leg, energy out through the heel. Inhale back to center, and then exhale to the opposite side. So really important here that you don't feel any weight shift from elbow to elbow. It's that exhale as we extend. Inhale, float, exhale. Very easy here to slowly lose that plank position, so just make sure that you're staying open through those hips. Hugging baby towards the spine. Exhale as we exert. Make sure you're not holding your breath. Strong through those shoulders. We'll do 2 more to each side. Last one here. Well done. Making your way now down onto your side and going into a slide plank variation. So coming down onto the left elbow, we're going to reach up, extend that right leg, find that side plank position, and again, focus on the breath first. So breathing into the front, sides, and backs of the lungs, thinking of that gentle lift up and in through that pelvic floor, and still trying to hug baby towards spine. So we'll keep that activation as we continue to breathe. Always make sure that you're strong through that left shoulder, that you're not starting to drop. You really want to press the chair away. Active through that right heel. Last breath here. And then gently we're just going to rotate under the left side body. And then inhale back to center. Again, we want to feel like it's the ribs drawing down gently to the opposite hip, rather than just the arm doing the movement. It's that exhale breath. Well done. I like to follow where my palm goes with my head. So if that's comfortable for you, go for it. Otherwise, you can keep your head pointing in front. I really just feel like it helps get that rotation. And last one here. Well done, and floating back down. I will change the chair around. We'll go to the other side. So again, we're going to find that lovely plank position, side plank position. Press the chair away. Lift up and in through the pelvic floor as we hug baby towards the spine, and just focus on that breath. Inhale through the nose and then exhale. Well done. Three more breaths. Last breath here. Let's add in the rotation now. So we're going to exhale as we thread in under the right side, and then inhale back to center. Exhale. So remember again, it is the ribs doing the movement, not the arms. So we want to think of that nice wrap, and then it opens back up. Well done. One more. Well done. Making your way now down onto all fours. Again, I'm just going to move my chair. And just going into cat-cow. So wrists under shoulders, knees under hips. We're going to inhale as we extend, looking forward, opening through the collarbones and finding length through the lower back. And then exhale, we're going to start to curl the pelvis, round through the spine as we press the floor away, gaze to inner thigh. Inhale, lengthen. Pelvic floor relaxes, sit bones open. And then exhale, lift up and in through the pelvic bowl, hug baby towards the spine, press that floor away. Inhale, find length. Really important when you're doing this exercise that you really don't just arch into the lower back. We get very good during pregnancy to really kind of let go and jam into the lower back. So I still want you to think about length when you come into this position rather than just letting everything go. So exhale, press the floor away. Inhale, lengthen. We're going to do the last one here and feel those two extreme movements, and then we'll stop in the middle. And then just stopping in the middle there. We're going to inhale as we prepare, exhale, hug baby towards the spine as we reach arm and opposite leg, and then floating back down, alternating side to side. Exhale, going into bird dog. Really important here to stay strong through the shoulders, pressing that floor away, and we don't want any weight shift side to side. Use that exhale breath to help hug baby towards the spine. Very easy with this to go fast, which you can see that I'm doing there now. I'm going to slow down, so really focus on that exhale breath and really think long through that spine, hold for a second and then float back down. We've got one more to either side. Well done. Gently just come into a rest pose here and just have a breather, just stretch out that lower back. Take a couple of deep breaths. Really focus just breathing into that belly. There's not quite enough space anymore for belly, just prop up onto those elbows, whatever's comfortable for you in this final trimester. Well done. Let's make your way now onto your bottom. We're going to go into reverse plank. So from this position, again, you'll have to have a bit of space for bub, so feel free to just go a little bit wider than your sit bones. Strong through the front of the chest, just making sure that you're open. Take that breath in, and then as you exhale, you're pressing up, lowering the bottom down, and then exhale into a heel slide. Inhale, exhale, press. Well done. Exhale, press. So if you're feeling super strong in that final trimester, by all means, when you come down for those heel slides, you can keep your bottom elevated. It's a lot more work though through the wrist, so just be mindful of the wrist. We are nearly there. I'm going to let my bottom relax down as it's too hard to work through my wrist at this moment. Well done. Last one here. And press. Well done. Making your way now into high kneeling. Really nice to just stretch out those obliques as they can get very tight during pregnancy as the belly grows. Coming into a lovely T section, we're going to exhale as we side reach. Inhale back to center, and then exhale. So just working with what's comfortable. You don't want to overstretch. Try and just keep your sit bones anchored down towards the floor, as that will just give you a better stretch. Inhale back to center. And we'll just go one more to either side. Well done.